Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why.
Good evening, everyone. I find everyone in good health. I want to say hello to my substitute co-host, coming from behind the scenes, Mr. Tyrone Jackson, with the Tyrone.net, calltyrone.net. Our usual co-host, the articulate and very engaging co-host, Miss Jocelyn Turner, is not going to be here with us today, and so you guys are going to have to put up with me for today. And you put up with me before, but not by myself. I think we have a very interesting topic this evening because we want to talk about the Medicare annual enrollment period. It's that time of the year that this is taking place. There's during the fall, and it's October 15th through December 7th. And truth be told, those benefits that you elect to take on at that time will be effective as of January 1. But before we begin our discussion, I want to have each of the guests briefly introduce themselves. We'll start with Mr. Benjamin Kane.
Hello, how's everyone doing? I'm Benjamin Kane. I'm an independent broker.
Okay, and we want to also introduce Mr. Cardi Alexis.
Hi, good evening. Thanks for having me on. I'm an independent broker. My name is Cardi Alexis.
All righty. And also Mr. Jacob Swanson.
Hi, Jacob Swanson. I'm a sales director for Jack Schrader and Associates.
Very good. Thank all of you gentlemen for joining us this evening. I think we're going to have a lively discussion about a very confusing topic even to the experts, not you guys, not you experts, but supposedly my patients think of me as an expert, and it's like sometimes I get as lost as they do as it relates to trying to figure out this whole Medicare. Let's start with, and anybody can take this first question. Tell us about Medicare. Exactly what is Medicare, and how does Medicare Part A, B, C, and D in terms of how do you define those? Anyone?
Okay, Medicare. We're talking Medicare Part A. Basically, it covers your hospitalization and some of the outpatient things that along that line, and then also the Part B are the ones that is the one that covers your doctor and your prescription drug, your doctor, and then we have Part D, and that covers your prescription drugs. And of course, we have Medicare Advantage plans, and those plans are your Part C, and there are Medicaps that are out there, or supplements that are available as well.
Now you have Medicare Part D. Give me what's the explanation for Medicare Part D?
That will be your prescription drug coverage. You can do it with a Medicare Advantage plan. Some of them have it with it, or you can do it as a standalone with your Medicare Part A, Part B.
Very good. So,
all right, hold on. So let me get in here real quick, Doc. So I know this is going to be a very complicated subject for a lot of our listeners, and I think you were very much correct when you said that it's complicated sometimes for even those who are supposed to be the experts. We have the advantage of having these three gentlemen on who, of course, know way more than we do. but I'm going to ask you to do me a favor and to treat me like a person who don't know anything, okay?
I always do, but go ahead.
So Dr. Kane,
I don't think that question was for you, it's for us to
Dr. Kane is
come across
supposed
as like we're talking to a third grader, a 3-year-old. Okay.
Absolutely. Dr. Kane is supposed to be an expert. You guys are experts, and I'm just hanging along for the ride, okay? So
Very good, Tyrone. I appreciate that. So
if you guys want, you know, Cardi or Jacob, if you want to add to that also, that would be great to for the audience. That would be also awesome. So,
Cardi, Jacob.
Yeah, I could add to that. You know, the Medicare, you know, is program. You know, pay for it through your Medicare taxes, and it's for individuals 65 and older. Those individuals that may have had a disability for 24 consecutive months, or those individuals that might be living with some type of end-stage renal disease.
Jacob, anything to add?
No, I think they did a really good job. I mean, really just part of our job as kind of brokers and everything is to simplify everything to layman's terms so people can understand kind of what is going on. You know, Part A, as far as like Ben said, covering the hospitalization, Part B covering your doctors, and Part D covering your drugs. That's about as simplistic as it comes as far as kind of how the coverage works for
Right.
original
And
Medicare.
And with Part C doing the Medicare Advantage plan, for which much of our evening is going to be spent on those Medicare Advantage plans, because this is a complicated enough subject that it's going to may take a whole lot more time than what we have available. So, and Cardi, you have to excuse me if I'm being redundant, but I was just trying to make sure we got an understanding of the difference between Medicare, the traditional Medicare, and Medicare Advantage plan. I don't know if you mentioned that when you were speaking. Can you allude to that?
Yeah, absolutely. Traditional Medicare consists of Medicare Part A, like Mr. Benjamin Kane mentioned, you know, so that's your hospitalization, essentially, and then your doctors. Medicare Advantage is almost like the simplest way I can put it is if you take Medicare Part A and then you add Medicare Part B and then parts of Medicare Part C, essentially, and you throw it all into a blender and you mix those benefits and you get what is called a Medicare Advantage plan. So Medicare Advantage plans have to be at equal standard or greater in terms of like overall benefits it provides to a member, you know, like original Medicare. And then, you know, it has its differences. For example, with original Medicare, it's open access to any doctors that choose to accept Medicare. Whereas with Medicare Advantage plans, it's based on networks, which we'll discuss further down the line, sir.
Okay, so and then and you guys can again tune in, chime in. So the one thing that I didn't hear from you, Mr. Alexis, was that the Part D sometimes is included in some of the Medicare Advantage plan, but you have a certain level of independence as to choosing what Part D plan you want to. Explain that.
Absolutely. So with Medicare prescription drug plans, they are included in some of the Medicare Advantage plans, and you can choose that through basically, you know, your overall drug usage. So a part of when a broker is working with a consumer, they intake certain informations about the drugs that consumer is taking, such as the name, the dosage, and the frequency, and they can input it into particular calculators that will then spit out to the consumer or the broker, which is going to be the more favorable in terms of savings.
All right. So, Mr. Swanson, so tell me about Medicare. I know Medicare, and correct me if I'm mistaken, Medicare is kind of an 80-20 plan. If you look at it from the private business world, it's like an 80-20 plan, which
Right.
your insurance pays for 80% and the person is responsible for 20%. So what is Medigap?
So Medigap, or another terminology they call is a Medicare supplement, is what most of them are called now. What that does is it wraps around Part A and Part B. So you still have your Part A and your Part B. And then any of the gaps that the client is exposed to, financial exposure, that Medigap offsets those costs. There's a premium involved, so you pay a monthly premium, and that goes to covering all of those costs.
And it's a little extra premium above and beyond what your premium may be for your Medicare plan. Is there a premium involved with Medicare or no?
Yeah, so if you're on a supplement, you still pay for your Part A and your Part B, so you still have those payments. On top of that, you would additionally pay for your supplement. There's multiple plans. I want to say right now there's about 7 or 8 different plans. The most common is a Plan G, called the Cadillac plan now. It covers things like excess Part B charges, inpatient, outpatient, doctor visits. The nice thing about a supplement would be that you're not limited to an HMO or a PPO to a specific network. If a doctor accepts or hospital accepts Medicare assignment, they will accept your supplement.
And so there's a certain amount of time that you have to sign up for that Medigap plan, if I'm not mistaken. And then if you get beyond that sign up period for the Medigap, and you can explain that.
Sure. So absolutely. I think I get what you're trying to lay down. So when you turn 65, a common phrase that you'll hear is something called guaranteed issue. So when you turn 65, it doesn't matter what your illnesses have. If you have medical history or anything, you can qualify for that plan with no underwriting questions. Outside of your initial enrollment period, you can change to a different Medicare supplement company or to a different supplement plan, but you would have to go through medical underwriting at that point. At that point, if it's been 5-6 years, we don't always get healthier as we get older. So it becomes a little bit harder to qualify for those Medicare Advantage, Medicare supplement plans. So typically they find that when you turn 65, if that's the route you want to go, getting on it earlier is a better option for you.
Is that when pre-existing illnesses may come into play in terms of what your rate or how much you pay for that Medigap?
Well, what will happen on a supplement or a Medigap plan is if you don't pass the underwriting questions, the insurance company or carrier just deems you uninsurable. So therefore, there's no policy for you. Go look somewhere else.
Right.
So there are guaranteed issue rights, and they vary from state to state. That there are opportunities where potentially you could get a guaranteed issue after you turn 65. That's where folks like Benjamin and Cardi, myself, help out agents and clients find those opportunities to try and help them out to see if there's an opportunity there.
That's exactly what I wanted to get to. That is, they may hear about it from other people and then think it's all over, but that there are people out there who can assist them in bringing this forward and being able to move forward in that complex maze. Well, Benjamin, now that you're back, what do you tell everybody about the annual enrollment period for Medicare?
For Medicare?
Yeah.
Okay. Basically, we have the initial enrollment period that each individual, when they're turning 65, or as Carter had spoken earlier, they have disability for 24 straight months, and then also I forget the third one he mentioned, but basically you get a chance to sign up for as an initial enrollment in terms of for yourself. You get 3 months prior to your birthday or your month that you're aging into 65, or like I said, once those 24 months are up, and then you get 3 months after your birth month. So it's a total of 7 months in terms of the initial enrollment period as you're aging in, should we say. But just the regular Medicare, for the regular Medicare. Now, if you're talking open enrollment, I think I don't know if we mentioned it already, that's December 7th. October 7th, for 15th through December 7th. October 15th through December 7th, you get a chance to enroll for any type of changes. If you want to make changes to your Medicare Advantage plan, or if you want to change the plan, sign up to a Medicare Advantage plan, a Part D, or just kind of go back to your Medicare and elect not to have any Medicare Advantage plan or supplement, and just wanted to go back, that's the open enrollment period that we're talking about there that starts in October 15th of this month through December 7th.
So Cardi, sorry. Cardi, look at these old eyes, and it's some small lettering. But Cardi,
what plan you on?
Oh, man.
I guarantee it's supposed to be here on Earth, but sometimes I feel like I'm on the moon. So Cardi, anything to add to that?
I think Mr. Benjamin Kane covered it very well in respect to the open enrollment period, and the fact that it started October 15th and it goes through December 7th of this year. So it's really important that you tune in to your health insurance options, especially during this time. It's something that's very, very important. And it's a limited time, so you need to remember.
All right, so guys, help me understand this. All right, so I turned 65, and according to the information you've given me, I have 3 months before I turned 65, and then another 3 months after I turned 65. All right, and I'm going to then enroll for Medicare. At that time, does it matter what the date is?
Yes, it does matter what the date is, because the date that you choose, because like Mr. Swanson mentioned, it's a 7-month window. So if you choose to enroll, let's just say your birthday is in April of 2023, right? So come January, you're able to start making a decision for a Medicare health plan, specifically Medicare Advantage related or standalone prescription drug. During that time, like I said, it's a 7-month window. So in January, you can choose to make a decision and to enroll, but that health plan won't start until the first day of your birth month. So if your birthday is in April 16th, you make your decision to enroll into a specific plan in January 3rd, it's not going to take place until April 1st of that year. Okay. Mm-hmm. Same thing as if you make that decision sometime in February or March, it's going to take effect into April. Now, if you make a decision during the month of April, right, that plan won't take into effect until May. And if you make a decision in May, it will take effect in June. And then I believe the last month of that window, right, Mr. Swanson, would be July, if I'm counting right. July 30th would be the last day that they can make an enrollment to be effective August 1st.
April 1st.
No.
No. Once they've passed April, right? Yeah, once they've passed April now, April 1st, they make that decision. It'll be effective the 1st of the following month. Right. So that 7-month window will be closed the last day of July in this example that I gave you. So once they've surpassed July now, then they're subjected to be able to change during the annual enrollment period that Mr. Benjamin Kane explained, or through special enrollment periods that Mr. Swanson can kind of go into lightly, if you'd like.
And I got this one question I need to ask. Before we go on any show, we kind of do our research. And remember, I told you guys it's pretty confusing from the start for this aged brain. The one thing that I kept seeing the annual enrollment period, AEP, October 15th to December 7th. And then I saw the open enrollment period, and I was trying to figure out, is there a difference between those two terminologies, and what is that difference, if any?
Yeah, I'll take that. We talked a little bit prior to this. So the annual enrollment period allows you to make a one-time switch. Keep in mind the Medicare Advantage plans are based upon an annual agreement with the insurance carrier, private insurance carrier. During annual enrollment period, you can switch, stay on the same plan, disenroll if you want to go back to original Medicare and pick up a drug plan, like a standalone drug plan. After the annual enrollment period, so post December 7th, your plan goes into effect January 1st, 2023. Let's say an opportunity or the doctor goes out of network and that is your favorite doctor and he's no longer covered by the carrier you chose. Within those first 3 months, you have I call it a get out of jail free card. You have the opportunity that you can change the plan one time. So you can go back to the plan you were previously on, or you have the opportunity to search where that doctor moved to if he's still on another carrier. So you still have some flexibility. You're not stuck for a whole year on that one plan. Maybe you made a bad decision. Maybe you got a bad agent that gave you bad information. You have that opportunity that you can still move off that plan without being stuck for a full year.
So now let's get into some meaty subjects here. What is a Medicare Advantage plan? Now, Jacob, I think I'm going to direct that at you since you just alluded to.
No way. So Medicare Advantage plans they're plans designed by private insurance companies that are approved through CMS. They offer a host of benefits outside of just parts A and B. They have co-payments, co-insurance. A co-payment would be something along the lines of you go to your doctor, you pay $5. It's a set amount. And then a co-insurance is a percentage. So let's say you go for radiology, they're going to cover 20%. That would be a co-insurance. So co-payment's a fixed amount. A co-insurance is a percentage of the amount being billed. They have the same structure, every plan. So some of them will have a premium. There are several plans that have a $0 premium. But it can fluctuate between markets. They have what's called a max out of pocket, which is actually one of the biggest benefits of a Medicare Advantage plan. Max out of pocket is a stop loss gas, is the fancy terminology for it. The way I explain it is your worst case scenario, if you're on a Medicare Advantage plan, you broke your hip, you had a collapsed lung, the most money you're going to spend is that max out of pocket. There's a lot of plans. Lee County, where I'm from, there's some plans that are as low as $2,900. So worst case year I have, the most money I'm going to come out of pocket, apart from paying my Part A and Part B, is $2,900. So they offer a lot of other ancillary benefits, stuff like dental benefits, vision care, but they're all structured very similar. The co-payments, co-insurance, max out of pocket. Some of them come with deductibles, whether it's a health deductible, and a lot of them are packaged with prescription drug plans. So it's kind of an all-in-one plan versus having your Medicare supplement. And then on top of the premium of that Medicare supplement, you've got to pay another premium for your drug plan. So that stuff's taxed on, and we're still paying a premium for our Part A and B as well. So cost analysis, the Medicare Advantage plans are very enticing to folks.
Well, based on the example that you gave, max being out of $2,900, just suppose that to traditional or the regular Medicare plan, it'd have been 20% of whatever that hospital.
Yeah, the way I explain it to agents that are kind of new to it is, my dad, I want to say I think it's 5 years now, he had congestive heart failure. He went to the hospital, was in the hospital for 2 days. Then he went into observation. He had 3 stents put in. They billed the insurance company over $300,000. Okay. He would have been on the hook. You go 80, 20%, right? He was still been on the hook for $60,000. That's if he just had original Medicare. That's, by all means, that's really nice of the government to do that. But 20% takes $60,000 out of your nest egg. And what does that look like?
My whole year paid, but go ahead.
That's why we have Medicare Advantage options and we have Medicare supplement options to try and offset that kind of billing. My dad, he paid his premium. He had a high deductible plan F. He paid the deductible, and that was all the cost that he had.
Now, let me ask this your question with regards to that Medicaid Advantage. And I think I heard this, so correct me if I'm wrong, is that not everyone will qualify at the same rate for the Advantage plan as you will for the Medicare A, B, and C.
or better yet, what are the qualifications for to enroll as well? On top of what
So,
Tyrone asked, what are the qualifications to be able to enroll in
sure.
these Medicare Advantage plans?
So you have to be a legal U.S. citizen, or be a lawfully in the United States. Ideally, it's called a resident alien. You have to qualify for Part A and B and make those payments. That's all you need to qualify to get a Medicare Advantage plan. There's no underwriting when it comes to Medicare Advantage plan. So folks that have issues as far as, like I said before, when we're talking about supplements, we have those underwriting questions. There's no underwriting questions for a Medicare Advantage plan. They are assuming all the risk as far as health options for the clients. And that's how they provide their benefits.
So, Cardi, how are these plans designed? You know, in the private world, I look at fee for service and HMOs and PPOs and all that kind of stuff. Are we seeing some of the same thing with these Medicare Advantage plans or Medicare plans?
Yes, sir. Absolutely, doctor. We are seeing similarities in how these plans are designed. We have HMOs, like you mentioned, which are the health maintenance organizations, the PPOs, which stands for Preferred Provider Organization. We have private fee for service in the world of Medicare, but you don't necessarily see it too much or any here in the state of Florida specifically. And then, of course, we have special needs plans, which I can definitely break down for you if you'd like.
Well, give me a little bit on the special need plan.
Absolutely. So a special needs plan is specifically designed for individuals with both, for example, they have dual special needs. Those are for people that have both Medicare and Medicaid. So the two different agencies, the federal Medicare agency and the state Medicaid agency, will coordinate to ensure that most, if not all, the costs are covered when it comes to medical needs for a consumer. And then you have what they call chronic special needs plans. You know, you have a lot of people here suffering from diabetes, chronic heart failure, those type of chronic conditions, unfortunately, are costing lives. So Medicare is putting an emphasis on that by offering these special needs plans that offer special care coordination and incentives to kind of help keep those people healthy through preventative maintenance. All these type of special needs plans too, doctor, include prescription drug coverage, and it requires you to have a primary care physician, sir.
Gotcha. So the HMO, people always asking the question, HMO, PPO, you just explained the special need plans, but why don't you give us a quick rundown of HMO versus PPO?
Yeah, absolutely. So with an HMO network is a little bit more closed off. So if I'm a consumer, I have to stay within that specific plan network or HMO network. Okay, so if I go outside of that, I will be responsible for all costs, except if it's an emergency or an urgently needed care in some plans.
What about being out of the area? If you're out of the area, let me put it this way. So I got my HMO from whatever insurance we talk about. I'm not going to name it by specific. Okay. But whatever insurance company we got, I got my HMO from them. But they basically got kind of my coverage is within Florida. I went and visited my niece in California. Now, all of a sudden, I get there and I get a gallstone, that requires immediate surgery. And so what would happen in that kind of a case?
So if that's the case, if that might be classified more as an emergency. So if you were on an HMO plan you would still get covered due to it being billed as an emergency. So you'd be responsible for your emergency cost share. And then from there, the plan would pay the rest because it's deemed an emergency.
And I'm out of network at that time because I'm way in California and I may not have a network there.
Exactly.
Okay.
And also, and maybe Jacob could emphasize more on this. There are some health plans that have benefits that will allow you to coordinate in other markets that they have networks in.
Jacob, he just called you out.
Well, so to kind of go back to the original point you're talking, so in order to sign up for a Medicare Advantage plan, another qualification is you have to live in that service area. Okay, so if I live in New York and Florida's got a really good plan, I can't just say I want that Florida plan. I have to live in the county that plan is in. You'll see a lot of advertisement right now, kind of Joe Namath and JJ Walker, and those are like, hey, you can get this amount of money. Put your zip code in first. So a lot of folks end up putting their zip code in. It's like, well, they said I could qualify for this. Is like, not in your zip code, you don't. So you're only able to take the plans that are available in your county. There are plans, there are carriers that offer passport options and travel, that they have a national network of doctors. So in the situation that you kind of provided is, if I was on one of those plans and I were to travel to California and something happened, I could go see a specialist as long as they took that HMO plan or that PPO plan. It would be considered in network. You'll see that typically with PPO plans more than HMO plans. But there's carriers out there that do offer basically a national provider directory.
So what that tells me is that I need to be specific. I need to make sure I understand my area of coverage when I choose a plan. Is that correct?
Yes, sir. Yes, sir.
Now, they were just talking about the HMO. Is that then that led into the second part of this question? Was that also the same with regards to a PPO?
So you want to take that one, Cardi?
Yeah, let me take that one. So with the PPO, it's a little bit different than the HMO, because with the PPO, if it still has a network of doctors, we call them the preferred doctors. And when you stay within that preferred network, you get a discount on your coverage. You get a discount on those services. It'll typically be very favorable, right? And a very favorable cost sharing when you stay in network. But there are times if you go out of network, as long as that doctor chooses to accept Medicare and you go out of network, you will get some coverage at a lighter discount, not compared to as if you would have stayed in network. So there is some coverage out of network when you look at that PPO product. With an HMO versus a PPO, cost-wise, a consumer might see favorable cost share, like a copay or co-insurances on HMOs, because they can control, with the closed network, you can control the consumer and the consumer behavior to keep costs down, versus a PPO, which gives that consumer flexibility, right, to go, in and out of network as they please. It's a little harder to maintain those costs on the carrier side. So you might see some consumers pay slightly higher co-payments or co-insurances on that PPO product.
Now I need to ask this: why would you want to change from? And we probably covered a lot of this already. But why would you want to change from traditional Medicare to a Medicare Advantage plan? What's the incentive for doing so? Yeah, I think you guys kind of.
That stop loss primarily would be the stop loss that we talk about, that max out of pocket. So if you just stay on original Medicare, that Part A, Part B, and you have to have a drug plan if you're going to go that route. Otherwise, you will have to pay a penalty, right? So I will pay those premiums as well as any doctor's bills until I'm broke on original Medicare. Okay. that stop loss, that max out of pocket on a Medicare Advantage plan, I was saying like the one where I'm from, there's some plans that are down to $2,900. The max I'm going to pay is $2,900. So in the situation like I was saying with my father, original Medicare would have paid 60 grand, or excuse me, he would have been responsible for $60,000. Well, if he got out of the hospital and the same thing happened 3 months later, he's going to have to pay another 60 grand.
Wow.
So with a Medicare Advantage plan, no matter what happens that year, the maximum I'm going to spend is $2,900.
All right. So what would prevent a person then from taking an Advantage plan? Is that they have to manage their finances and cost equation? So it appears that the Medicaid Advantage plan would be more appropriate for a person than it would be just the standard Medicare.
It's
Medicare Advantage plan.
It's your standalone. If you are a client, it is completely advantageous, to put it politely, to pick an option, whether it's a supplement or a Medicare Advantage plan, to assist. The Medicare Advantage plans, like I said, financially are very enticing to folks. Like I said, there are multiple plans as far as a very low to zero premium plans, and still have a max out of pocket that will stop you from losing your whole nest egg. You'd be kind of silly not to. There are incidences where maybe you're on to give you maybe some examples to kind of say why maybe you wouldn't. If you're on maybe a group plan or a retirement plan that offers a equivalent benefits or better benefits than Medicare does, that would be an option where maybe you choose to stay on a plan like that. 9 times out of 10, it's really hard to beat Medicare plans as far as a Medicare Advantage or supplement route if you went that way. But it's very advantageous to the clients to look at or entertain Medicare Advantage.
So one of those things you referenced, Jacob, sounds as if I was in a situation where, okay, I'm 65, but I decided to work until I drop dead. One of them sounds as if one is going to be the primary plan, and the other one's going to be the secondary plan. You patients hear that all the time.
Okay.
Explain the difference.
Yeah, so you're going to start getting into the weeds on some of these. So what happens is there's kind of a rule of thumb. If it's less than 20 employees, Medicare would be the one that would pay first. So you could have a Medicare Advantage. You can have dual coverage. Typically, it doesn't make sense if you're on a group plan to pay your Part B premium, because your Part B premium is based upon your tax return from 2 years ago. So if I have to pay a premium for my group plan, I've got to pay a premium for my Medicare plan. Doesn't make a lot of sense financially for me. Typically, you'll pick one or the other to go with them. At that point, it's kind of a cost analysis and benefits analysis at that point to really sit down with the clients and figure out what the best route is. A lot of folks, what you'll see if they have group benefits, or maybe they're married, this is probably the most common one. You're married and your spouse is trailing behind you 2-3 years. So they'll stay on their group plan until their spouse turns 65 as well, so they can both go on to Medicare together. That would be an example, and that would be why you would delay your Part B. If you delay your Part B, you still have the same opportunities when you take your Part B, like your initial enrollment, that you can still get guaranteed issue. You can still have access to your Medicare Advantage plans. It's still considered your initial enrollment at that point. I hope that.
Cardi, let me ask you.
Yes, sir.
Can changing the Medicare Advantage plan actually be a great way to save money? How does that play? Saving money, switching from one plan to the next, 1 year to the next. Give us some feedback on that.
Absolutely. One of the points that Mr. Jacob Swanson made earlier is that with the Medicare Advantage plan, it's an annual contract from the time that you enroll through in the year to December 31st of that year, right? So each year that plan is subjected to change its benefits. And there's, right now on any given county, there's dozens, if not hundreds of plans available with all different types of benefits and prescription drug formularies. So it's important to reach out to a broker, or reach out to a resource that you have locally that can basically help you with the tools to make that decision. So they'll put in your doctor, they'll put in your prescription drugs, and then they'll see what is the most advantageous based on the benefits and the prescription drug usage that you are looking for.
Okay, so you mentioned something that I just briefly it's kind of a yes or no question, but you may have to. Do you have to re-enroll in Medicare every year? I think I know the answer, but still, I want to make sure that our listeners know the answer as well.
No, you don't have to re-enroll in Medicare. Once you sign up for your original Medicare Part A and B, as long as your premiums are up to date, you should not have to re-enroll. And then
okay. So now then the question would be, what about if I missed the open enrollment period? What do I do? What's the consequences of it?
Do you want to take that, Jacob?
Thanks, Cardi.
You want to deliver the bad news, right?
So I'll kind of gloss over it because every situation is a little bit different. When you turn 65, if you delay your Part A and Part B, there can be consequences. If you take your Part A when you turn 65 and you decide not to enroll into a drug plan, there is a penalty. It's not the end of the world, but that penalty will be tacked on to a premium monthly for the rest of
your life,
your time. Part B is very similar. The Part B penalties are a little stricter, or a little heavier than the drug plans. So it is, if you do miss it, I would highly recommend speaking with an agent to see what opportunities there are on how to get you on the plan. If you delayed it, if you decided to do nothing and you're not on a credible coverage like an employer group plan, they have your general enrollment period starts in January, and that goes from January 1st to the end of March. Okay. They changed it this year. Before, you could not have an effective date of your Part A and B until July 1st. So you could enroll back in January, but that penalty is still going to accrue for another 6 months.
Wow.
Okay. So they changed it this year, which is actually pretty nice. So if I delayed, it has to be the first of the following month. Okay. So if I enroll in January, I can get a February 1st effective date for my Part A and my Part B. So I don't have to wait that 6 months, and I can get coverage immediately.
Now, I thought he was also a part of the question was a person is already enrolled in Medicare A and B.
Okay.
And it's time for enrollment. What happens, or are they required to do anything? Or can they just do nothing and their plan that they're currently in just roll with them? What happens if at enrollment time I have a plan and I do nothing?
Sure. So there's two parts there. And then the term, this is where it kind of gets in the weeds for everybody.
All
the
right,
terminology
between
like original Medicare and you have a Medicare Advantage plan. So if you have original Medicare, theoretically, you don't have to do anything. You've got your Part A, your Part B. Now, if you don't take Part D, your drug plan, you're going to accrue that penalty. So typically what you'll see is the traditional way is you'll take Part A, Part B, and you'll roll into a low-cost drug plan to avoid that penalty. Okay. Mm-hmm. Now, if you have a Medicare Advantage plan, that plan will roll over year, and you don't have to do anything. So as long as that plan stays, the carrier decides to keep that plan going year over year, I don't have to do anything. It is in your best interest to review those plans, though. So like Cardi was saying, these plans change annually. So if what we see most commonly is the formularies. So if I'm on a drug that maybe it's a tier 4 and it costs $300-400 a month, well, next year that plan, another carrier might have that drug down to a tier 2 where it's $5, $10, zero copay. So now my out-of-pocket expense for my total annual out-of-pocket expense between my premiums and my drugs just dropped down significantly. If I'm paying $500 a month for my drugs, at the end of the year, how much am I spending?
And I know you guys can't say it. I know you guys can't say it, but
right?
As a listener, I can say it. You know, this is the reason why it's important to have someone like you gentlemen in your corner to be able to contact to find out. And I like the fact that you said that you need to have someone specific to your area to be able to know the changes and be able to manage you into the best care for you. And as we know, as we get older, our health changes from one year to the next as well.
So one of the main benefits of working with an independent broker versus working specifically with a carrier is we have the opportunities to represent multiple products. Okay, so I don't have to be a one-trick pony with just carrier A. I can offer A, B, C, D, E, F, G. I can offer all the carriers that I can get licensed and contracted with. So I can review all of your drugs with all these different carriers and try and help find out which is the best one to suit your needs, versus if I just have carrier A, that's the only carrier that I can offer. And if I'm a sales guy, guess what I'm selling you? The only thing I can sell you. So it's like walking onto a Ford lot and asking for a Toyota. They're going to sell you a Ford.
Well, you know what that raises, Cardi, is that and it kind of answer the question, but I want to just be sure. I can save money by monitoring my Medicare Advantage plan and any changes in it from year to year with other Medicare Advantage plans. As kind of what Jacob alluded to, you want to be sure that you stay up to speed as to exactly what it is, what your plan represents, and what somebody else's plan may represent.
Yes.
But Doc, hold on, but also to that, Doc, so that sounds good, but how does an individual, non-broker, non-doctor, be able to monitor the differences and changes in the plans with ease to be able to make a decision on their own?
I think that's what Carly was going to say. Go ahead.
Yeah. So, first every year, every October 1st of every year, if you're on a Medicare Advantage plan or a prescription drug plan, you get what is called an annual notice of change. That goes into the new benefits that you're going to have if you choose to auto renew your plan come January 1st. So if you stay and you do nothing, this is what your benefits are going to be come January 1st. So it tells you those changes, the annual notice of change. It's important. You can make these decisions, on your own, but it's just kind of like the same industry, like with taxes. You can go on, TurboTax Intuit and try to navigate it on your own by going, doing it that way, or you can go to, a tax specialist, someone that went to courses and certified to be able to assist you. So that's the benefit in working with specifically a broker that represents all the products and has the tools to help that consumer and work for that consumer.
What Cardi and Jacob, what it sounds like is, I just want to make sure I'm not remiss in saying that just as you can look at your plan when they, at the end of every year they revisit what your plan offer, you also have to be cognizant of the fact that it may be taken away some of the benefits that you had from the previous year and not just add to some of the previous benefits. Am I mistaken in saying that?
No, not at all. The plans can go up or down the year over year. If you're trying to do it by yourself, to answer yourself, Tyrone, Medicare.gov is where you would try to go, and do it yourself. You have the opportunity where you can key in the drug formulary, the drugs that you take, or your parent, if you're trying to help your parents or a loved one, you type in all the drugs that they would take. You would try and select the pharmacy that they want to work with. And then it'll basically kind of do a calculation and give you a total annual out-of-pocket expense. There's a lot of nuances between the plans. As far as if you're just looking at numbers and cents, sometimes it's not always just numbers and cents. Sometimes the ancillary benefits overcome maybe a $5 difference here or there. That's where it kind of comes into place.
Yeah, Jacob, you kind of jumped ahead and mentioned some of what I was going to allude to at a later part. But, it's funny how you said to Tyrone that your parents, you didn't say that to me about your parents.
We got called old earlier, so I'm in the boat with you, brother.
Anyway, with that being said, I got a text from some of my colleagues, and they got a couple of questions.
Sure.
They did say, and which I think I know the answer, but I just want to be sure. Carter, do you have to buy a Medicare supplement if you have a Medicare replacement plan?
So when you say Medicare replacement plan, are we talking like a Medicare Advantage?
I think that's what they were alluding to.
Yeah. So no. So if you have a Medicare Advantage plan, you cannot be on a Medicare supplement plan.
So it's kind of auto exclusive of one another, right?
Yeah, it's one or the other, supplement or advantage, because there's no coordination of benefits. They can't coordinate benefits with those two.
Okay. So the other question one of the listeners sent me was, if you're employed and over 65 and receiving health care coverage from your employer, will you get a penalty when you select Medicare after retirement?
Typically, no. As long as it's considered credible coverage,
right,
there's no penalty applied to it.
And even if you're employed to your 81, 91,
right,
and then switch over, you still won't have a penalty.
Right. What I always recommend is reach out to your human resources person, whoever is in charge or administering that group plan, to make sure that it is considered credible coverage by Medicare. Because if it's not, that penalty will apply.
And then if it is a credible coverage, and I'm just referencing Medigap right now, even the part where you mentioned about Medigap, you got to do it within a certain amount of time of your birthday. If you're employed and you have a credible coverage plan and you don't elect to go to traditional Medicare until you 10 years post 65, you can still have that same option of not being penalized because you were on a credible insurance plan. Is that correct?
Correct. You can do it. Typically in that situation, a lot of folks will automatically be enrolled into their Part A, and they'll delay the Part B portion of Medicare until they leave the group coverage. At that point, it's called a special election period, and they would have the opportunity to go onto a standalone drug plan or onto a Medicare Advantage plan. They still have the option to go onto a supplement if they want to go that route as well.
Now, is it common for a person to, let's say, still be employed at the 65 or when they come up that time, and to elect to go with the Medicare and deselect going with the care that's offered by their employer?
Again, at that point, it comes down to a cost analysis. Like I said, 9 times out of 10, it's really hard to beat a Medicare Advantage plan. Keep in mind, it's subsidized by the government already, where the employer is taking all of that responsibility as far as the financial coverage of those bills. So 9 times out of 10, the Medicare Advantage plan is going to beat out an employer group health plan. But like I said, a lot of times where I see it most common is someone that has a trailing spouse. They'll stay on that group health plan until the spouse turns 65. That way they both go on to a Medicare plan together.
Right, but see, that brings up the crux of my real question. So I heard you mention it earlier. You have a trailing spouse, and I happen to be in that situation. So, so I have a trailing spouse, and what I am hearing or what I have heard is even though I'm a trailing spouse and she has a good coverage, it may still be in my better interest to go into my Medicare than to go on to that to stay with that coverage.
If it's Medicare Advantage that you're
Well,
going.
again,
Well,
it comes down to a cost analysis, in all fairness, because you're going to have to look at what the Part B premium is, what the premium is for the group plan. A lot of group plans you still have, they're typically based upon HMO PPOs, just like Medicare Advantage. But if I have to pay out of my check $150 every other paycheck, I'm at $300 a month just for the premium. I haven't made any co-payments. I haven't made anything.
right.
Where I can go on a Medicare Advantage plan and potentially it could be, like I said, at a zero cost plan, but I'm paying my Part B premium. My Part B premium, it's based upon when you file your taxes. It starts out this year. The lowest is 169.10, I believe it is. So
169 is the fee, but
Part B premium.
But when you're talking about the income, that's what's the bottom line?
It could tailor to it. So it really comes down to a cost analysis, Tyrone,
Right.
depending upon how much the spouse is paying, how much you could be paying.
But one thing
I
you
couldn't
did,
just wave a wand and say, yeah, that's definitely better. It really comes down between the group plan that you're on and the route that you want to go for your Medicare options.
and Jacob, I just want to make sure I make clear to these guys. You said 150. I don't want anybody to get stuck on the term 150 because I've seen some of these insurance plans, employee insurance plans. You're looking at a tremendous amount of money when you go from that single employee coverage to the quote unquote either spouse and or family coverage.
Yes.
Yeah,
Right.
so,
You had a lot of people get excited when you said that 150.
yeah. That's why I want to make sure I straighten that up real quick.
I see a lot of group plans that start out at $800 a month too. So
Exactly.
like I said, it comes down to cost analysis.
I need to bring Ben back in right quick because we're getting close to wrapping it up. But just before I bring him in, can anybody tell me the difference between, are there any things in terms of benefits to going with, are there a star rating to these plans? I've heard about 3-star, 4-star, 5-star plans. And what's the difference in them? Either one of you gentlemen can take that and deal with it.
Yeah, absolutely.
It,
So with the Medicare Advantage plans and prescription drug plans are rated on a 1 to 5-star rating, 1 being the lowest, 5 being the highest. So, the middle tier is a 3-star. I believe if you are under 3 stars for 2 years in a row, the health plan can be subjected to have a suspension because it's a low performing plan.
They kick you off.
Yeah, basically, they will kick you off as an insurance carrier if that specific plan is rated low. I would aim for 3 stars or higher if I'm a consumer. Now, if a plan is a 5-star, so like they take a lot into components when it comes to the star ratings. They take, customer service, care coordination, the overall effectiveness of the product, the network. So they put all of that into the factor. Now, when you have these 5-star plans, which there may be some available depending on which county you live in, you're able to make additional one-time changes into that specific health plan if there's one available in your area.
Now, someone posed the question that if there's 5-star plan, you can possibly enroll into them any time of year, irrespective of the annual enrollment period. I don't know. Somebody just mentioned that. I don't know how true that is.
Yes, that is true, Doctor. They can. So outside the annual enrollment period, They have what they call a 5-star special enrollment period.
Whoa.
And you can enroll anytime throughout the year outside of that annual enrollment period.
Wow.
One time for
And
that.
how do I go about finding out those 5-star plans? If I'm as ignorant as I am, how do I go about finding those 5-star plans?
There are options. You
Talk
can.
to you guys.
Well,
Be
yeah,
the best option.
absolutely. You can reach out to, like a local broker, like Mr. Benjamin Kane, and he can get you all the analysis that you need. And what's also one of the points that, and I hate to go back on two things, Doctor, if I can briefly. I don't mean to break the structure, but one of the qualifications for enrolling into a Medicare Advantage plan is you have to make an informed decision. So, folks, after a couple glasses of wine, stay away from the Medicare stuff.
Don't drive, right?
Yeah, and don't drive. Definitely, don't drive.
All right. So Benjamin Kane has been missing in action. Benjamin, if you hear us, I need you to step up because I got one other set of questions, and then we're going to look at closing. I'm looking at the additional benefits of having these Medicare Advantage plans. Are there?
Mr. Benjamin Kane did text me. He's dealing with
ongoing. Okay.
He asked me to cover for him.
So go on ahead and cover it, Cardi.
Yeah, absolutely. So and the second thing I wanted to say, Doctor, that Mr. Swanson mentioned about having a broker. Sometimes when you have certain issues, it's easier to call someone locally and sort through that issue or meet with them. We do suffer a lot when we deal with those 800 tele numbers because sometimes they just don't pick up or have that sense of care that you'll get when someone's in your same local community. Their kids are going to the same schools as you. It's a different feeling.
Well, before you go on to those other additional benefits, I will say this to you, Cardi and Mr. Jacobs. When I use it, I think we should use the term locally loosely because it's more about what that person, who that agent is, what kind of agent he is he helping them look out for your benefit. In today's technology, just being local, a guy that I can pick up a rock and throw around, down the street and hit him in the head may not be, one may not be the best for me, but two, a guy that I can pick up the phone with any time of day, know them personally. So I'd rather use the term personal.
Yes, sir.
Being more personable than more so than just locally. Because some people you can pick up the phone. My agent, they're distant, but I can pick up the phone any time of day. I'm not gonna say night because I don't want him calling me any time of day. but pick up the phone any time of day, talk to them. They get back with me with some of the questions that I have imposed and so on and so on. So I just want to kind of clarify that it doesn't actually have to be in the same zip code you're in.
But yes. that begs the question, because earlier it was mentioned on several times the advantage of having a broker agent or someone who can assist you in your area because of the nuances of changes that happen specific to your zip code, county, and so forth. So
that broker knows.
So if you're going to go outside of that, is it now also important that you make sure that that broker a person is versed in your area as well?
There's advantages of working with someone locally. They're going to have a better pulse of what the networks are within those plans. We'll give you the best example. So I can tell you all the important hospitals locally here in Lee County, but if you asked if an agent called in and say, hey, I need help in the middle of Idaho, what's the best hospital? Google, here I come. I'm searching, trying to find out information. So in that aspect, a good local agent will have a better pulse of the important kind of networks, important doctors, important hospital chains that should be a network to be able to provide the best service for their clients. there's a lot of doctors, a lot of hospitals out there. It's hard to know everything. So a lot of times a local person is going to have a better pulse of what's going on in your community.
But sometimes those agents also can they may know somebody locally.
Yes.
Yeah.
That they can refer you to. Is that not
Yes, sir.
correct?
Yes, sir. Yes, sir.
And just to add to that too, Doctor, the brokers, like when we certify for the entire state, and we have access to data on every single county within the state of Florida. So like you said, you know, it's nice to have local, but it doesn't limit to do business with just someone that you know, because they have access to that. And, you know, especially due to COVID, unfortunately, society has gotten comfortable with where we can do things virtually over the phone, through email. So there's so many routes, but I think the point that you touched, which is extremely, extremely important, is the personability of dealing with someone, you know, that you know, someone like Mr. Kane.
Okay. And you guys.
Well, I was going to say the number one thing you mentioned is an agent that picks up the phone.
Right.
Yeah. You want to have somebody that actually answers the phone and helps you out.
Right.
Okay,
I'll take that any day of the week.
Yeah. Cardi, the last question goes to you. Give us some of the additional benefits that Medicare Advantage plans that may cover, but traditional Medicare may not cover.
Absolutely. I like going through this one because it's really like the sweetener. When you have Medicare Advantage plans, it'll cover things like on certain plans like fitness benefits, where you can get a free gym membership. It has dental benefits, vision benefits, and hearing benefits. Because remember, original Medicare does not cover these type of benefits. You know, you can see plans that cover transportation, over the counter,
Drug medications.
Yes, absolutely. And then also there's additional things and services that promote health and wellness on these type of plans that just original Medicare does not offer. So,
Awesome.
Yes, sir.
Well, guys, with that, I think what I want to do is we're going to go ahead and end the show. I would like for each one of you guys to place in the chat so we can post on our website contact information that we can provide to our listeners so that they will be able to, those that choose to do so can contact you guys and discuss further any of their needs and concerns. So if you guys can place that here before you get off as best you can. And then while you're doing that, since I got you guys focused on this, I want to say that I'm gonna put a disclaimer on Mr. Benjamin King. Yeah. That's a relative, you know. It's a relative, but he wanted to make sure that there was no bias in terms of the questions being answered and discussion with you guys. So I'm happy that you guys were very able to give a. Carney, you put in Benjamin's number. I just want to make sure you put in yours as well.
Yes.
Okay, that you guys were able to deliver your messages without any coercion or whatever that might have taken place. As we do with every show, toward the end of the show, we ask each participant to please provide us with a statement in terms of what they would like the audience to know. And so what I will do is start out with you, Mr. Swanson.
Best information takeaway I would say is take the time to reach out to an independent agent. Not to shameless plug our industry, but find yourself a good agent, someone that's going to take the time, explain everything to you, go through the benefits, make sure your doctor's covered, make sure that your drugs are covered. If you don't have anyone that's going to take the time to review the benefits with you, they're not a good agent. You need to find someone else. Take your time, find an agent, reach out. There's several agents out there. You'll find a good one
To assist with you. All right. Mr. Alexis.
Absolutely. Well, I definitely thank you all for being here. Dr. Kane, thanks for inviting Jacob Swanson and I, along with Mr. Benjamin Kane. Mr. Tyrone, thank you so much for your coordination earlier, and all the viewers out there. We really appreciate you guys taking your premium time to join us tonight. I would say one thing, and I guess this is a disclaimer too. I've actually had the opportunity to work with both of these gentlemen in the past. I've worked with Mr. Jacob Swanson through my days at Jack Schrader and Associates. I've also had the opportunity to work with Mr. Benjamin Kane, and I still, to an extent, have partnerships with him and help support him in different ways. We worked at United Healthcare. And this is something that I'm going to say that tags along with Mr. Jacob Swanson's recent statement about, taking your time on a broker. Benjamin was extremely compliant. And that's really, really important. He was the type of guy to dot his I's and cross his T's when I worked with him during our United Healthcare days. When it comes to ethics, he is definitely top tier. He won't do anything that would make you feel uncomfortable. So I think a part of that, in looking for an agent, is looking for someone that's compliant and has a good moral compass in when they're dealing with people. So that's all.
And I think that would stand to say for all of you guys, in terms of your persona and your expertise. Tyrone, your final comments.
Well, first of all, I'd like to thank all the guests for coming on. We don't take it lightly here at Pause for the Truth in the folks that we choose to come on and share information with the audience. It was both an honor and a pleasure to listen to you as you imparted some very important information to our listeners and to our viewers. And I'm going to kind of, in my mind, recap the impression that I got. And first of all, is that this is very important. Make the time to get it right. Now, the fact that, you have every year you can make changes, but the sooner you get it right, the more advantageous this is for you and your healthcare. It has been said in many, many times in many ways on the show today that the value of a person who takes the time to get it right for you is immeasurable. So that could be a broker, could be an agent, you could be you yourself. But don't go into this here lightly, understanding that it's important, extremely important, that you put what did Mr. Alexis say? Dot those I's and cross those T's. Yes. If you're one of those individuals like me who forget the I's sometimes, then you're going to be better served by getting someone who does that. All right. This is a very complicated subject, and it's one that all of us who get the advantage of living a long life will have to deal with. And so it is important that you take the time to observe this information and to put the things in place that are going to help you live a comfortable life.
With that, I thank you, Tyrone, and I'd like to thank all of our guests, including you, Tyrone, coming from behind the scene. You guys have offered very valuable and very illustrative information as it relates to what's available to us out there. Obviously, the details, the devil is in the details, so you have to make sure you talk to someone to give you those details, to get rid of that devil. Because there's nothing written in stone to say that you can do a half-ass planning job this year because you got next year to correct it, because death nor illness is based on your time. It is based on its own timing. And if you don't want to adhere to it, that's your bad luck. Only thing, the difference between the two is one you around to witness how bad of luck you've had. The other one, don't make a difference anyway because you're long gone. So I would say one last thing, and that is, I think here at Pause for the Truth, we try to present to everyone the opportunity to hear from experts, to hear from people who are out there that can help provide them with the realities of today's world. And that if you guys, I would love for people to continue to listening to our program. I expect that I may have these guests back as we do with every show, have you guys back to help elaborate on even more detailed information as it relates to Medicare advantages, and just plain old being sick of insurance. With that, I'd have to say we're looking forward to our better looking host back next week. And I would like to say, be enthusiastic, go out and vote. You don't do like I did. I was so enthusiastic. I showed up at the poll this morning, but that's a secret. You guys shouldn't tell anybody that I had the date wrong. So make sure you vote next week. And then with that, I will have to say good night to everyone.
Good night, everyone.
All right, thank you so much. Good night.